Hello, my name is JMcConnell, and today we'll be discussing Leopold's maneuvers. At the conclusion of the lesson, the participant will be able to summarize the advantages and disadvantages of performing Leopold's maneuvers and demonstrate the correct steps in order for performing Leopold's maneuvers. Just like this photo, at times we'd like to look inside the mother's belly without any trouble and see how our baby is positioned, but we're not always able to do that, nor do we need to. We are able to use what God has given us and be able to determine a great deal about our baby. Just as it says in Ephesians 2:10, "For we are God's workmanship, created in Christ Jesus to do good works, which God prepared for us in advance to do." So we're able to use our hands and tell a great deal about how our baby is positioned in utero. So the definition of Leopold's maneuvers is an abdominal assessment technique used in labor to determine the lie, presentation, and position of the fetus. Leopold's is also used to determine the location on the abdomen that the fetal heart rate is best heard. Advantages to performing Leopold's maneuvers. It's non-invasive. There's no other equipment, machines, tools, or anything else that's needed to be able to perform Leopold's. All you need are your hands. Another interesting thing is that research has shown that it's very accurate when carried out by experienced clinicians. And it also has been shown to promote a positive relationship between the clinician and patient. While there are a couple of things that may hinder an accurate Leopold's result, such as if the clinician is inexperienced and not familiar with doing the maneuvers, or perhaps the mother is overweight, for example. However, there are actually no risk factors for Leopold's maneuvers. Now, let's review some terminology. The picture on this slide reviews fetal lie, which is the position of the long axis of the fetus. It can be longitudinal, which as you see here is straight up and down, and it's the darker image. Oblique, where the fetus is at a diagonal, or transverse, where the fetus is lying sideways in the abdomen. Our next term to review is fetal presentation. Fetal presentation is the part of the fetus that is entering the pelvis and is usually cephalic, as we see here in the first picture, breech, which is shown in the second picture, and shoulder or transverse, which is depicted in the third picture. Remember, when we're talking about breech, it can be a frank breech as pictured in the bottom left or a footling breech as pictured on the bottom right. Fetal position is the relationship of the presenting part of the fetus to the pelvis, and it can be listed as either anterior, posterior, or transverse. As you can see on the top row of pictures, it is the position of the head as it goes into the pelvis. For example, is the anterior part of the head coming first, or is it turned sideways, such as in transverse? The lower row of pictures displays the fetal head and the position of the fontanelles as the fetus makes his or her way through the pelvis. Now we'll get into the steps of performing Leopold's maneuvers. But first, let's talk about what we'll do before the procedure. Before the procedure, you will want to do things to make the mother comfortable. For example, wash your hands in warm water. No one likes to be touched on their belly with cold hands. Next, encourage the mom to empty her bladder. You'll want to position her in the bed with a wedge under her hip and her knees flexed. Be sure to give her a pillow under her head to help make her comfortable. Make sure you drape her appropriately and explain to her what you're about to do. What are you going to be doing to her? What is it going to tell you? Things like that. While you're getting ready to begin, Inspect the abdomen for bulges, fetal movement, and also look for the long axis of the fetus. Can you tell where the long axis of the fetus is located just by looking at the abdomen? Be sure to use the palmar surface of the hand with your fingers together and use gentle but firm pressure. If you're right-handed, you should stand at the woman's right side. However, if you're left-handed, you should stand on the woman's left side. For the first maneuver, we will want to determine the fetal part in the fundus. As you recall, the fundus is the top part of the uterus. So while you're facing the woman, place your hands at the top and side of the fundus. Be sure to note the size, consistency, and shape of the fetal part that is in the fundus. Think about what you're feeling as your hands are on her abdomen. Is it round and smooth like a fetal head? For the second maneuver, we want to locate the fetal back. Facing the woman, place your hands on either side of her abdomen in the middle. One hand should push the contents of the abdomen toward the other hand to stabilize for palpation. The hand that is palpating begins near the fundus and palpates towards the woman's back. Continue this process downwards towards the woman's back. Once you've completed that side, reverse hands and repeat. What did you feel when you palpated? If you palpated smaller, protruding, and irregular shapes, it's most likely the small parts of the fetus. But if you felt something that was firm, smooth, and consistent, that was likely the fetal back. While doing the third maneuver, we want to determine the presenting part. Facing the woman, grasp the part of the fetus situated over the pelvic brim. Determine if what you are feeling is the fetal head. This maneuver should confirm what was felt with the two previous maneuvers. Is the presenting part movable? If it is, more than likely the fetus is not engaged. But if it's not movable, it probably is engaged. For the fourth maneuver, we need to determine the descent and attitude of the presenting part. So this time you're going to turn facing the woman's feet. Place your hands on the sides of the uterus below the umbilicus and pointing towards the symphysis pubis. Pressing deeply, slide your hands toward the pelvic outlet. If the cephalic prominence is felt on the same side as the fetal back, the fetus has an occiput presentation. In other words, the crown of the head is presenting first. If the cephalic prominence is felt on the same side as the small parts, the fetus is in a vertex position, which is usually the most favorable position for labor. If the cephalic prominence is felt equally on both sides, the fetus is more than likely in a military or posterior position, and some position changes may be needed once labor begins. After you've determined the cephalic prominence, slide your hands together towards the pelvic brim. Do your hands meet? If the presenting part is floating and not engaged, your hands will come together around the presenting part, as you see on the bottom right picture. If the presenting part is engaged, your hands will stay apart. This is because the top of the presenting part is inside the pelvis, and you're not able to palpate the top of the presenting part, as you see in the top right picture. Once you have completed the procedure, you should have a pretty good idea of how the baby is positioned in utero. Of course, there may be times that further testing would be indicated. However, Leopold's usually is successful in the hands of the experienced clinician. Once you have finished examining the woman, share the findings with your patient. Locate and verify the fetal heart rate. Remember, the optimal fetal heart sounds are usually heard over the curved part of the fetus, closest to the anterior uterine wall. Most often, this is the fetal back. And be sure to document your findings. You have reached the end of the presentation. Please practice your skills and be prepared to complete your checkoff satisfactorily with a nurse educator. To be considered signed off on the skill of Leopold's maneuvers, you will need to be able to summarize the advantages, disadvantages, and purpose of Leopold's maneuvers, and correctly determine the fetal lie, position, presentation, as well as the best place to auscultate fetal heart sounds on 3 separate patients. If you have any questions, please refer to your textbook or contact your nurse educator for more information. Thank you.